Good day. My name is Tom Doub. I'm an assistant professor of pediatrics here at Vanderbilt University Medical Center, and I'm on the faculty with the Center for Patient and Professional Advocacy here at Vanderbilt. I'm here today to talk to you about a study that we recently published about an effective program to reduce malpractice claims and payments in a large orthopedic practice. Our center has a broad program of research looking at the impact of professionalism, including the impact on patient care, patient outcomes, wellness, and other concerns. But in this particular study, we were interested in studying the impact directly on medical malpractice in a large distributed network, such as an orthopedic practice. This study looks at a period of over 16 years of medical malpractice claims. And we started with a baseline period of 4 years looking at their experience, implemented a professionalism program 12 years ago, and then followed their experience throughout that entire time. So what we learned in this research with OrthoCarolina is that when we identified a group of physicians who was at higher risk of medical malpractice claims relative to their peers, that by sending a peer to go and have a conversation with them, to share their patient complaint data with them, they were able to significantly reduce their risk of future claims. We found as we followed them over time, adjusting for all of the historical confounds, over an 80% reduction in the medical malpractice claims experience for that group of physicians that was identified to be at higher risk. But one of the most surprising findings of this research to us was that not only was that group who spoke to their peers impacted by this program, this professionalism program, but the practice as a whole saw benefits. One of the things that we learned from this research was the importance of really having the appropriate leadership and the appropriate infrastructure within an organization to support this professionalism work. So there was a significant leadership commitment at OrthoCarolina to supporting their professionalism program, to holding each other accountable to their values as an organization that set the standard for how they wanted to proceed and how they wanted to work together and the kind of experience they wanted to provide as an organization. They also built the infrastructure to gather the data necessary from patients to identify trends, to identify individuals who were stood out relative to their peers in terms of the kinds of feedback that patients were bringing to the table. And thinking about how people might use this research going forward to either change their practice or how organizations might respond to it. One of the big lessons here is that you don't have to accept the status quo and unprofessional behavior in an organization. What we know is that often people leave organizations because they are exposed to unprofessional behavior on behalf of their peers or their colleagues. Patients may express, as they did in this study, dissatisfaction with their experiences, and they may vote with their feet and leave a practice and not come back and not receive medical care that they might need. So what we've learned through this work is by giving that feedback to individuals in an appropriate way is that most people can actually make improvements in the way they interact with patients and reduce the risk of that occurrence happening going forward.